This is the bronchopulmonary segments module. This is the right lung. This is the left lung. We're going to remove the upper lobe of the left lung and going to look at the segments. This is the apical uppermost lobe. This is the posterior that lies towards the back of the upper lobe, and this is the anterior which faces the front chest wall. So these three segments comprise the upper lobe. We have the apical part, we have the posterior part, and we have the anterior part. We now move on to the middle lobe. When we talk about the middle lobe, how many further segments do we have? We have the, this is the middle lobe. For the middle lobe, we have two segments. We have the lateral and medial segments. So these are the two segments of the middle lobe. The lateral one lies towards the outer lateral chest wall, and the medial one lies towards the inner mediastinum chest wall. So this is the middle lobe. Once the middle lobe is done, we move on to the lower lobe. The lower lobe has a total of 5 segments. We have the superior lobe, this one. This is located on the posterior surface just below the oblique fissure. I'll show you the fissures in the end. And then we have 4 basal lobes, right? All these 4 are the basal lobes. First we do the medial lobe. I'll remove this and show it to you. So I'll remove the superior lobe and then show you the 4 basal lobes. First and foremost, we have the medial basal. So this is the medial basal, the one that is adjacent to the mediastinum at the lung base. And then we have the anterior basal. This is the anterior basal. This is the one that faces the anterior chest wall at the base. Then we have the lateral basal. The lateral basal is the lateral part of the lower lobe at the base, and then we have a posterior basal. So there's a medial basal, there's an anterior basal, the lateral basal, and the posterior basal. These are the 4 basal segments of the lower lobe. Let's put back the superior lobe and let's put back the upper lobe of the right lung. Now we can see that we have fissures here. Look at this. This is the horizontal fissure, and all the way posteriorly to the anterior side, we have this as the oblique fissure. So the oblique fissure separates the upper lobe and lower lobe of the right lung, and the horizontal fissure separates the upper lobe and the middle lobe of the right lung. Moving on to the left lung. When we talk about the left lung, we only have one fissure, which is the oblique fissure of the lung. When we talk about the upper lobe of the left lung, you can see that we have an apico-posterior segment. This is basically a fusion of 2 lobes, the apical segment and the posterior segment. Both of them, a fusion of the apical and posterior segments, are found separately in the right lung, in the left lung, Then we have the anterior segment. This is the anterior segment. This faces the anterior chest wall. And then we have 2 segments, the superior lingular segments and the inferior lingular segment. The superior lingular segment is part of the lingula. It's analogous to the right middle lobe of the right lung. So this is the superior lingular. And then we have the inferior lingular segment. This is the part of the lingula analogous again to the right middle lobe of the right lung. So the lingula in the left lung is functionally correspondent to the middle lobe of the right lung. These are the 2 lingular segments. So all of this is the upper lobe of the left lung. We then move on to the lower lobe of the left lung. When we talk about the lower lobe of the left lung, let's remove this upper lobe. Yes. Okay. So once we've removed the upper lobe, it's exactly similar to the one we did for the right lung. This is the superior one located on the posterior surface just below the oblique fissure. So this is the oblique fissure and this is the superior segment. Then we have the anterior basal segment. This is often fused. This anterior basal segment is often fused. It's often fused, represents a combination of the anterior basal and medial basal segments found separately on the right. So we call it the anterior medial. You can see this is the medial area. So the medial area and this anterior area is often fused. Moving on to the lateral basal, this is the lateral basal segment. This is the lateral part of the lower lobe at the base, and this is the posterior basal. This is the posterior surface of the lung base. When we put them all together, basically, we get our left lung. So these are the impressions of the left lung. First up, we have the aortic arch here, and then this impression is for the descending aorta. This area is for the left ventricle, also known as the cardiac impression. This part is the lingula of the left lung. This is the tongue-like projection called the lingula, and this is the cardiac notch. This part beneath is the diaphragmatic surface, and as you can see, this is the oblique fissure. The oblique fissure divides the left lung into the upper lobe and the lower lobe. Again, one more thing that we can see here, this is the aortic arch, and here we can see the subclavian artery. Ideally, there should be a groove for the first rib here, but you can't really appreciate that on this model. That's it for the left lung impressions. Now we will cover the impressions of the right lung. Now, first and foremost, we have the groove here. This is the groove for the azygous vein. We know that the azygous vein is the final vein that the hemizygous vein drains into. So this is the groove for the azygous vein. Then we have this impression for the superior vena cava, and here another impression lies for the brachiocephalic vein. This impression here is for the groove for esophagus, and just posterior to the groove for the esophagus lies an impression for the descending aorta, but the descending aorta is more marked in the left lung impression. Then we move on to the groove for the inferior vena cava here. So this was the groove for the superior vena cava, and this is the groove for the inferior vena cava. And then we have the cardiac impression here. This is the cardiac impression. So let's just revise this one. This is the azygous vein impression. This is the superior vena cava impression. This is the inferior vena cava impression. This is the cardiac impression. We have a impression for the groove for esophagus, and just posterior to it on the left lung, that area on the left lung corresponds to the groove for the descending aorta. We do not appreciate the groove for the descending aorta on the right lung. That's it. In some places we can also see a groove for the subclavian artery here, but it's more appreciated on the left side, not the right side. A final heads up for the fissure levels. So for the right lung fissure, that starts at the level of the T2 vertebra. Here is the level of the T2 vertebra on the posterior thoracic wall, deep to the medial border of the scapula. And then it runs obliquely downwards and forwards. While it's running downwards and forwards, it crosses the fifth rib laterally and courses towards the sixth costal cartilage, or the sixth rib anteriorly. So that's the oblique fissure of the right lung. It ends at the sixth costal cartilage here, close to the anterior costophrenic angle. It separates the upper lobe from the lower lobe, and inferior half of the middle lobe from lower lobe indirectly. Moving on to the horizontal fissure. This horizontal fissure, it starts at the mid-axillary line. So this is the mid-axillary line of the body along the fifth rib. It begins here where it meets the oblique fissure. So this is where the horizontal fissure starts. It runs horizontally forwards all the way across the fourth intercostal surface, corresponds to the fourth costal cartilage anteriorly, and ends at the sternal border of the right lung on the fourth costal cartilage. It separates the upper lobe from the middle lobe. Then we have the left lung. For the left lung fissure, we can see that this is the only fissure, so it's the major fissure on the left lung. It starts from the same vertebral level at the T2 level as the right lung oblique fissure was starting. So it starts at the T2 level, runs posteriorly behind the medial border of the scapula, courses downwards and forward, crosses the fifth rib here, fifth rib in the mid-axillary line, and ends near the sixth costal cartilage anteriorly near the cardiac notch region, but does not enter it. It separates the upper lobe from the lower lobe. Both oblique fissures start at the T2 level posteriorly and run obliquely downwards and forwards, and both oblique fissures end at the sixth costal cartilage inferiorly. This is the level of the sixth costal cartilage. and both the oblique fissures are ending here. The right horizontal fissure starts at the 5th rib in the mid-axillary line, runs horizontally and ends at the 4th costal cartilage at the sternum. That's it.